Hey guys, we're going to go over the Venturi oxygen delivery device. What I have in front of me is a Venturi mask. The Venturi mask delivers low to moderate flow oxygen that is precisely controlled. This device is able to deliver a specific amount of oxygen concentration. Oxygen is delivered depending on the flow rate and the entrainment port size, which I'll talk about that in just a minute. The Venturi mask delivers up to approximately 50% of oxygen with a flow rate of up to 6 liters per minute. This oxygen device does allow for room air to be mixed with the oxygen. The Venturi mask fits over the nose and the mouth. You will see here there is a metal piece that conforms to the bridge of the patient's nose. This allows for securement of the mask to the patient's face. On the sides of the Venturi mask, there are 2 ports for the patient to release exhaled air. The base of the Venturi mask attaches to a flexible tube that is then attached to an adjustable valve. Adjustment of this valve helps determine the oxygen concentration provided. So as you will see here, there are multiple types of oxygen concentrations to choose from. We have everything from 24% all the way up to 50%. Okay? With each of these oxygen concentration levels, it correlates with a certain flow rate. For an oxygen concentration of 24% to 31%, it correlates with 3 liters of oxygen per minute. That would be your flow rate. Okay? For your higher oxygen concentration levels of 35% to 50%, they would correlate with an oxygen flow rate of 6 liters per minute. Okay? As I twist and pull on the valve, that allows me to choose each of these oxygen concentration amounts. Okay? You'll notice that when I adjust the oxygen concentration level on the side of this valve, it is either opening or closing this air entrainment port. Okay? With a higher oxygen concentration level, it closes my air entrainment port. With a lower oxygen concentration level, you'll notice that the air entrainment window then gets larger. And so as the window size is larger, this allows for more room air to be mixed in with the oxygen that comes through the device. When I have got the approved oxygen setting on and I have the appropriate flow rate set up, I will then make sure that the oxygen is flowing through the mask. Before applying to the mask, you want to confirm that that oxygen is in fact running through the mask. When applying the mask to the patient, place the mask over the nose and the mouth of the nose, and then put the straps around the patient's face here. Okay. And I've got that metal plate at the top secured to the patient's nose. The Venturi mask is for patients who require administration of a specific amount of oxygen. It is commonly used for patients who have COPD, as this device helps prevent further CO2 retention. This concludes our Venturi mask demonstration video. We look forward to seeing you in the next. Thank you.